Hello, welcome to Miki's Kitchen. I'm Miki and I'm a dietitian. I'm an advisor to people who have problems with their health such as high cholesterol, high blood pressure, and high blood sugar. Today, I'm going to talk about blood sugar and then I'm going to make a dish using one of the ingredients that lower blood sugar. Well, let's get started.
Diabetes is a chronic disease involving consistently high blood sugar. It's caused by the insufficient functioning of insulin, which is the only hormone that can lower the blood sugar level. By contrast, there are several hormones that raise the level. The human body is basically made to endure hunger, and to avoid death, it has several ways to raise blood sugar. However, people in lots of countries now live in an age of plenty, and for health reasons, they care more about lowering their blood sugar level than about raising them. Unfortunately, there are two big factors that negatively affect the function of insulin. Obesity. Obesity is the main factor that weakens the functioning of insulin. The body has both subcutaneous fat and visceral fat, and the latter has a bad effect on health. It secretes a certain substance that weakens the functioning of insulin and causes the blood sugar level to go up. People over 40 especially tend to have a lot of visceral fat, so they should take care to avoid accumulating it. They can do this through proper exercise and diet. Aging. Do you think that the supply of insulin is infinite? The answer is no. Aging is one of the factors that decreases its secretion. It's said that the store of insulin decreases by around 60% by the time a person passes 60. And if you use too much insulin by consuming high carbohydrate meals, it's exhausted faster. To save your insulin, you have to pay more attention to your eating habits as you grow older. What kinds of eating habits do you think pose a risk for the wasting of insulin? One is consuming excessive carbohydrates. Sugar in particular sharply raises the level of blood sugar, and this wastes insulin. If you are concerned about becoming diabetic, you have to cut down on sweets in order to save insulin. Another dietary habit that wastes insulin is eating food items in the wrong order. If you have carbohydrates such as rice, bread, or noodles first in a meal, the blood sugar level goes up sharply. This is called a blood glucose spikes, and it tends to waste insulin. You should start each meal with dietary fibers such as vegetables, mushrooms, and seaweed, and be sure to chew it very well. The best order for meal is to start with food rich in dietary fiber, then consume food rich in protein, and only then have carbohydrates. If you do this, the blood sugar level goes up very slowly and you need less insulin. Chewing well is also important for reducing the size of meals. Chewing well stimulates the satiety center of the brain, making you feel full and reducing the amount of food you consume, especially carbohydrates. A third risky eating habit is skipping meals. There are people who skip breakfast because they don't have an appetite or enough time in the morning. But this sets them up for a rise in blood sugar after they have lunch. If you don't eat for a long time before lunch and you are extremely hungry just beforehand, the lunch raises the blood sugar level very sharply as a reaction to the hunger. To save insulin, avoid these eating habits I've just mentioned. Controlling one's blood sugar level is really important, but lots of people don't worry about it because high blood sugar involves few subjective symptoms. It gets quite high, only a few subjective symptoms appear, such as thirst, numbness, and frequent urination, and these show up little by little. You should know what happens when the blood sugar level gets high. Well, next time I'm gonna show you this. So, see you then.